As of today, Sunday, Uganda has 2,263 confirmed COVID-19 cases, out of which 1,037 are still being treated. There are only about 1,500 dedicated medical workers to treat COVID-19 in hospitals. The current situation is such that there are more trained health personnel than active cases, but with the rising number of cases, this will soon be reversed.
Our facilities are soon overwhelmed with the numbers of COVID cases. And as I've indicated before, the more the numbers that are admitted in hospitals, the less the attention that the health workers will be providing.
According to Minister Cheng, the reason there have not been many deaths is because medical workers are spending more hours attending to these patients.
They will be overwhelmed. Before, when we had fewer numbers, each patient would be attended to for over 30 minutes. Now that attention will reduce to 5 minutes to 1 minute because there are too many people to attend to. And then we shall start seeing the number of deaths increase.
Even in communities where there are far more aggressive measures by the community, this virus is making more people sick and killing people. So the population has to take the responsibility on itself.
Also, there might be more deaths because the country's ICU system is inadequate, just about 350 ICU beds, or an ICU bed for every 11,428 Ugandans. According to Dr. Richard Idro, the president, Uganda Medical Association, the public lost faith in messages on COVID-19. And with the new wave of community transmission, he thinks the Ministry of Health has to deal with the problem at hospital level.
Our initial interventions were conducted very well in the prevent stage, containing the situation, but not that well for the management capacity. The bed capacities have not been increased significantly. By now, Nambole should have been completely prepared out, and we have not achieved this. We are supposed to have some tents with additional beds in the regional referral hospitals to try to prepare the beds, and this has not yet been done. And then the surge of health workers to be increased, recruited to build up this has not been done sufficiently. And lastly, until now, we have not involved our private health facilities.
On Saturday, the Director General Health Services issued new guidelines requiring private hospitals to establish isolation centers, and Dr. Idro thinks this creates more risks if private medical workers are not trained.
Potentially, many people who are admitted to those holding centers may eventually test positive. So the kind of cadre, the kind of training all those individuals will have should be the same like those who are in the COVID treatment centers. There is no difference between the health workers who are currently treating patients in the COVID treatment centers other than that having had additional training in infection control and going through the guidelines. And that is what we are saying.
Experts continue to paint a gloomy picture of Uganda's days ahead with COVID-19, and it may come back to what the population seems to have moved past: personal vigilance. Edward Mhumza, NTV.